For many of us, collecting things over the years isn't that unusual. But for people with hoarding disorders, it can be debilitating and even stressful. But a Stanford study shows virtual reality can make letting go of things that much easier. So tell us about your study, VR therapy for hoarding.
One of the things that we know is very helpful for treating hoarding disorder is cognitive behavioral therapy, a very skills-based treatment. We know that the core of hoarding disorder involves an attachment to items and difficulty letting go. And so practicing letting go is one of the treatments embedded in this therapy.
How prevalent is hoarding?
Hoarding is very, very common, and it's actually under-recognized. It was just in 2013 where hoarding disorder was first named an actual diagnostic entity in the manual that we use for the American Psychiatric Association.
There is some kind of taboo with hoarding. People don't really want to discuss it, at least those people who suffer from hoarding.
Yes. Individuals with hoarding disorder not only live with the signs and symptoms that they have, but also there's a lot of commentary that they also have to live with in terms of people feeling like it's a moral failing or something that they're not doing, as opposed to thinking about hoarding disorder as a disorder that has a brain basis.
So what are you finding here as you go through all this?
I don't see how much I have until, like right now, I'm looking around and going, wow, wow. It's overwhelming.
Why is it easier to get rid of things, to declutter through VR rather than doing it when you're right there in your own home?
When you are in person with an object, it has a certain feeling to it. It has a certain smell sometimes, maybe the smell of a loved one. And those sensations are very, very powerful attraction to that item. Whereas in VR, you can have separation and distance from all of those sensations.
And what were the results?
The majority of individuals who participated reported that they were able to translate that practice into real life. Individuals with hoarding disorder feel alone, they feel isolated, and being part of a group and a community and doing these activities really builds network and support.
So that embarrassment turns into hope and inclusion.
Yes.
How does that make you feel to get rid of that?
Actually good. There's an empty space.
And you can let go?
And I can let go, yes.